Welcome back to the Weight Loss Collab. This is Dr. Betsy Dovec. I am a bariatric surgeon and I am a diplomat in the board of obesity medicine. And today I am going to talk about weight loss medications, GLP-1s, who they're great for, what they are, how to take them, what are the potential side effects. I'm dishing out on everything. So the first thing is, who should take these meds? Are they right for you? And a lot of people are curious about them. Some have looked into it, but some are a little bit afraid. And if that's you, that's normal. And hopefully today I could break it down so that you know if, this is an amazing treatment option for me. So the big reason that people want to take them is twofold. And that is, number one, you want to lose weight. You want to lower your BMI and you want to also lower your health risk. Number two, particularly diabetes. So they do have the indication for both weight loss and for diabetes. So there are a few different types of patients that come to see us at our practice here at Body by Bariatrics. The first type, clearly we are a bariatric surgery practice. Like I said, I'm a surgeon. That's always going to be my number one passion. And of course, helping all those lose weight and keep it off. But we do see a lot of post-op bariatric patients. I do think that this particular patient population, we get it. We get that this journey is lifelong. We get that there's ebbs and flows. There's weight loss goals hits, there's stalls and plateaus and frustrations, and even some weight regain. And that's normal. That's all part of the journey because life happens and things get challenging. And there's a lot of layered on things with emotional eating and everything else that happens. So if that's you, my goodness, don't feel ashamed. Don't feel discouraged if you're like, oh my God, I had surgery. Why am I now thinking about undergoing another treatment option with these medications? Well, as you probably heard me talk about, the GLP-1 medications on post-op bariatric patients are honestly the most successful. Post-op bariatric patients will do the best. I've described that after bariatric surgery, kind of the secret magic that happens almost instantaneously is that your GLP-1 levels will increase. We really don't know why. There's lots of different theories, but if you look at the blood levels, the serum levels of your GLP-1 levels, they're up after surgery, which means that if you do have prediabetes, insulin resistance, PCOS, infertility, a lot of those things that are linked to insulin regulation, metabolism, blood sugar control, a lot of those things will immediately start to normalize. Whereas, most of our patients, 98+% who are type 2 diabetics, will leave right after their procedures, no longer on any of their diabetes medications. So that's pretty darn cool. And that happens to you as well, especially with the gastric bypass. So that's a whole nother podcast episode. But if you're thinking about undergoing bariatric surgery, I do think that the gold standard in treatment in surgical options is the gastric bypass, is the best metabolic operation that exists. So you've had a bariatric surgery, a sleeve, a SATI, a DS, a gastric bypass, your levels will increase. Now, let's say after surgery, and I would say even starting as soon as 3 months after surgery, you can start to explore something like a GLP-1 medication, especially if you quite haven't achieved your goals or you feel like on the bell curve, you're a little bit off of it. So with that, what we would recommend is that you start one of these medications and they increase your GLP-1 as well. So guess what? GLP-1 plus GLP-1, this is some synergy. This is a really just an effect that will help you to be very successful very quickly. So like I say, you're going to be a super responder if you've had bariatric surgery to these medications, which is awesome. So that means that you probably will be on a relatively low dose of these meds and you're going to start to see some results. You might also see some side effects. things like nausea, particularly. You might have some constipation. You might have some acid reflux, some regurgitation, because they do slow your gastric empty. So we would recommend that you start a GLP-1. Now, there's two different types. There is semaglutide, which when it is brand name for diabetes is called Ozempic. And with semaglutide is brand name for weight loss is called Wegovy. This medication is made by Novo Nordisk, and it is a weekly injection. It starts very low dose at 0.25 milligrams weekly for 4 weeks. You can inject this medication in the back of your arm, in the front part of your thigh, or in your abdomen. I personally think that the abdomen is the easiest. Wipe it off with alcohol and then kind of go for it. Now, there is also tirzepatide, and tirzepatide, just to be clear, is honestly better. It's better for weight loss, and anecdotally, it has less side effects. I've heard that people seem to tolerate it a lot better. I have a lot more complaints for nausea with semaglutide than I do with tirzepatide. Now, there's two different types, of course, two different indications, same exact bed, same exact dosage in this case. They slap a different label on it. So if you do have diabetes, which by the way, a diagnosis of diabetes means that you have at some point in your life a documented proven hemoglobin A1C greater than 6.5, or if you have a fasting blood sugar greater than 126, that means you are defined as a diabetic. And so if you have that, again, with semaglutide, that's Ozempic. And then with tirzepatide, that is Mounjaro. Now, if you don't, you could then get it for a weight loss indication, and tirzepatide for weight loss is known as Zepbound. Now, it's the same med, starts at the same dosing. It starts low dose, 2.5 milligrams weekly for 4 weeks. Now, why is tirzepatide better? In addition to being a GLP-1 agonist, tirzepatide is also a GIP agonist. And that means that it has a dual mechanism of action that helps you to lose even more weight, so you'll respond even better. Whether you've had surgery or you haven't, I think tirzepatide is the better option. And if you see me, I would always start to recommend that either in its brand name form as, again, Zepbound for weight loss or Mounjaro for diabetes. Or if you do have an exclusion to these medications, we do offer compounded versions, which is basically the same meds, the same active ingredients. They're from a reputable, trusted pharmacy that we will drop ship it directly to you, and you'll get it in that tirzepatide or semaglutide compounded form. And you'll get a bottle of medications. It's still injectable, and we have dosing guides and also injection guides for that as well. So we would prescribe a medication for you, and you would start it. And then the exciting thing is, there's no one size fits all. So this is very personalized to you. You are the one that's going to dictate exactly how this goes. So everybody starts low dose, whether that's on semaglutide, Ozempic, Wegovy at 0.25 milligrams weekly for those first 4 weeks, or if you're on tirzepatide, the Zepbound, the Mounjaro at 2.5 milligrams weekly for those first 4 weeks. You will decide when you have a little bit left. Number one, are you ready to go up to the next month? So for tirzepatide, that's 5 milligrams. And for the semaglutide, that's 0.5 milligrams. And how do you know if you're ready to go up? Well, if you feel like you're doing well and you don't have side effects and you're tolerating it, don't really feel much different, let's go up. If you are nauseous, you do not suffer in silence, my friends. You will let me know. You will shoot us a text. We're super easy. We're very concierge. So you'll shoot a text to Body by Bariatrics. Our number is 407-543-0971. Even if you want a consult, just text us there and we will write you back. If you're like, I'm ready to go up, we will call it into your pharmacy the next dose. You go and pick it up. We let you know when it's ready, and that's it. So we want to keep this super easy so that you get the results you want with no hassle. I think that's super important. These days, we're all super busy and I want to keep it convenient. So again, if you are nauseous, what do? we can prescribe something like Zofran, which is ondansetron. I give you 8 milligrams of little dissolvable tablets. They go under the tongue. Now, Zofran is also very constipating, so just be very careful. And we also, when you become a patient of ours, we send you our medical weight loss guide. This is a pretty nice guide that shows you everything from, let's talk about the diet high level. Let's talk about all the incredible benefits. Let's talk about our offerings, our comprehensive program with small group therapy, with the dietary advice and emails and videos and meal plans and motivation and movement. And it also talks about the side effects. So we have a whole page in there, I think it's page 20, that is dedicated to constipation tips. Everything that we recommend is over the counter. It's all safe. It's all non-habit forming. It's things like adding a scoop of Miralax to your fluids every night, drinking enough fluids, getting at least 64 ounces of sugar-free clear liquids a day, avoiding sugar, really aiming to also do things like Dulcolax. If you feel like your pelvis is full, you can always do a suppository or an enema. And then finally, you can also do Smooth Move Tea, which I think is probably the most effective. Once people try the other things, they're like, it's okay. It's not the greatest. And then you go for that. It's like, boom, all of a sudden we're going. So happy pooping. I hope that you guys are easily able to have your bowel movements as well. So we are going to help you to mitigate those side effects and hopefully do really well with it. So is this right for you? Yeah. If you're a post-op bariatric patient, it sure is. The second type of patient that might be interested in the medications is somebody that has a lower BMI. So a BMI less than 30. And you can calculate your BMI, by the way, by just Googling it, going to BMI calculators, putting in your height, putting in your weight. And if your BMI is on the lower side, well, guess what? These meds also work really well for you. So it really does help thin patients get thinner. It does also do a whole host of other things for it. So it helps with the food noise that might be creeping in. It helps if you're starting to get a little bit older, especially women, if you're now in that perimenopausal tract. The hormonal balance, the more progesterone, the lower estrogen levels, that really causes you to hold on to your weight, especially in that midsection. So if you're somebody that like, man, I always just, I kind of reeled it in. I ate some more protein. I started to take more walks and those extra couple of pounds came off. How that's not happening? Well, these medications are fantastic at kind of just pushing you in the right direction and helping you to lose more weight. So I think that they are phenomenal for that. And even as your BMI does drop below sort of that indication, which is 27 to 29.9 with some weight related issues, even when it gets below 27, you need to be on these for maintenance. I think that obesity is a chronic disease. We know this. And so you need to be on your chronic therapy, your treatment plan for it for longer term. So how does that look here? So just like with the bariatric patients, you might be a super responder, you might be super sensitive. So we want to make sure that we are titrating that dose up slowly. You may never, again, get up to that highest dose of 15 milligrams weekly, and that's okay. You might get up to it, and then you might want to say, hey, I've hit my goal weight. I'm thrilled. I'm at 120. This is all the weight I want to lose. Let's start to go backwards. And so again, we can go backwards, 15, 12.5, 10, all the way down even to 2.5. And again, the half-life is 2 weeks, 14 days. So you can start to even take these every other week. And I do think that you should, again, remain on these medications, even just a whiff of them, a little of them, 2.5 milligrams every other week as a maintenance. It really just helps to keep that nice steady state, that new set point that you've achieved. It keeps your weight in check. It helps with all the things. And I do think, again, that if you are somebody that is going to just stop them altogether, especially if you stop them cold turkey or not on the lowest dose, man, you're probably going to see some weight regain. And that is super frustrating. And that's really just what's happening. And then finally, the third type of patient I see is those who have higher BMIs greater than 30, greater than 35, greater than 40, you keep going up. The more weight that you have to lose, the less likely GLP-1 medications or any medication is going to be efficacious enough for you to be able to achieve your goals. If you're looking solely at the statistics, you're looking at the kind of outcomes. There are outcomes from clinical trials that were put out by the manufacturers of the medications. Again, Novo Nordisk is semaglutide, which is the Wegovy and Ozempic. And Eli Lilly put out a lot of their trials, the Surmount trial, for example, the clinical trials that looked at, again, the safety, efficacy of these medications for the tirzepatide, Zepbound, and Mounjaro. And when you look at them, they're really boasting some really high weight loss amounts. But what we are finding, and if you look at the American Society for Metabolic and Bariatric Surgery, or ASMBS society, a few months ago, they put out a big study that looked at the clinical trial results versus the real world evidence. Patients, where they start in their BMI, and how they do with these weight loss medications. And what we're finding is that these meds are just not doing what they're saying they're doing. It's not being replicated in the real world. Especially the higher your BMI, the less likely you are to achieve those goals. So we want to make absolutely certain that if your BMI is up there, I get it. You want to say that you've tried everything, you've done every diet, you've done every exercise plan, you've given it your all, you've done these meds, and you can say with certainty, yes, I have tried them all, and now maybe it's the time for me to look into bariatric surgery. And I get that. That's a big decision, and nobody really wants to have bariatric surgery, and it's like, oh, man. But I can tell you that you're going to have the best results with it. I'm not going to ever undermine that it is surgery. I get it. There's risks. I get it. There's a lot of consideration. There's a lot of preparation, education, just making sure that you do it and do it right, to have the best outcomes, to really put in that mindset work, to be like, am I really ready for this kind of huge change in my life? And I get that there are those stages of change. I've talked about this a lot, where maybe you're contemplating it, you don't know, you're doing the research, and maybe that's even how you stumbled upon this little discussion here on the Weight Loss Collab podcast today. And when you're in that contemplation statement and state of your life, I would really kind of maybe alter between contemplation and even preparation. Why don't you get some more information? I think information is so powerful. And having a conversation with myself, any type of weight loss expert that really understands the trends and can talk to you about you, your history, your health, what your truly realistic outcomes could potentially be with these medications. I think that's so important for you when you're looking at where you are in your life. What is your weight holding you back from doing? Why do you want to do this? Why do you want to do this now? And I think that surgery is something that, of course, is completely underutilized. I know this. If you look at all the data of all those who qualify, less than 1% of those actually get it. And I think that, there's financial considerations. Do you have insurance coverage? Do you have an exclusion to these medications? Do you have, are you just afraid? Are you somebody that's, you're just not at the right place. And I get that. But I think there's no harm, no foul in exploring it, having a conversation. You don't have to commit to it. There's no obligation. It's something that you can just kind of kick the tires and just kind of figure out if this is the right thing for you at this point. So we would love to talk, and we make it really easy. We love to text so we can get set up. Again, text us. You heard the number. Text us, go to our website, click on Get Started Now. We'll set up a virtual consultation. We'll make it really easy. And then you can decide, looking at your next steps, that this is the right thing for you. Because chances are the medications do have some downside, and they do have some frustrations. So some of you may, again, not have coverage for the medications, which we get. Like I said, we do have some compounded options, which the tirzepatide is about $50 a week, and the semaglutide is about $40 a week. And maybe that's not in the budget right now either. I know the economy is in a tough time right now. So if that's something you're working on, your overall just wealth and financial status, this might not be the right time for you. Or maybe this is the right time for you to kind of look into that. Maybe you are somebody that has a history. There are some contraindications to these medications. You have a personal or family history of MEN2 syndrome, which means that you've had a history of medullary thyroid cancer. You've had a severe history of pancreatitis. I get some of you might have had pancreatitis. Maybe it was a very mild episode. Maybe it was related to gallstone disease, biliary tract disease. And so for you, maybe there's some considerations. Maybe you have some pancreatic issues, that this might not be the right thing for you at this time. So, something to consider. Maybe you have some gastroparesis, which is a very delay in gastric emptying, already a baseline. And so maybe the side effects from it, again, it slows the transit through your gastrointestinal tract. And so you might have some gastroparesis type symptoms again from that. The stomach, the food and the drink that you ingest just sort of sits in your stomach, and maybe that would just really exacerbate those symptoms of gastroparesis just too much for you, and that might not be the best thing for you either as well. Or maybe you're somebody that gets on the meds and you're like, no, I can't do the side effects. I just can't tolerate it. I just don't like the way I feel. Sometimes there's other kind of more obscure, more rare issues with them, and things like sometimes joint pain. I've realized muscle weakness. Maybe you just don't like the way you feel on it. And you don't like the way you feel with some hypoglycemia, low blood sugar. You might have that as well. So you might feel like, I don't like it. So I just don't want to feel nauseous all the time. I feel pukey. Maybe you're somebody that is a woman that's had babies and you really suffered with morning sickness, and maybe it's triggering you. It's bringing back some PTSD symptoms from that, and you don't like that. So we have to we work through those things. Again, we have a registered dietitian, Hannah, of course, my co-host here on the Weight Loss Collab. She is somebody that's excellent at helping you to kind of navigate the dietary types of things you can do to make sure that you're being compliant, but making sure that you're eating to try to like ward off some of those hypoglycemia type symptoms and those sorts of things as well. And maybe you're just not seeing the results, because the truth is sometimes a GLP-1 agonist, a GIP agonist isn't exactly what you need. And with that, it can be really frustrating that, man, this miracle med, it's the magic bullet. It's working for everybody else. Look at these people. Like, what are you doing? Tell me your secret. Oh, I'm on a GLP-1. Oh my God, I can't wait for that for me. Oh my gosh, it doesn't work a quarter of the time. 25% of patients, it's not going to work for you. Again, especially if your BMI is already high, it's not going to work. And that is not something that means, God, I'm a failure at even this, that you should feel ashamed of. It isn't. You should not feel ashamed of that at all. You should feel confident that there are a lot of other options. So yes, we've spent a lot of the time already, all the time, talking about the GLP-1 medications and a little bit about them, of course, their side effects, their benefits. Some of you, again, will be on that bell curve, off the charts, responsive, doing great, hitting goals, doing it quickly, at a low dose. And some of you, it takes that 6 months to be truly therapeutic, to really be able to see it. So just hang tight and we can, again, just really personalize this. Everybody is different. There is truly no one size fits all in the way this goes and how you will respond. So let's talk about it. Now, I do want to briefly talk about the other medication options. And one of them is phentermine. And all of you have heard of that. A lot of you have been on that. It's been around for decades and decades. It is a class, it is a scheduled class of medication. So that means that it does require my DEA number to be able to prescribe this medication. It can be a little addictive. It does have an addictive potential. It basically mitigates, or it tries to mimic rather the sympathetic nervous system. So it's called a sympathomimetic, which means that it is a medication that is really just triggering your fight or flight. So it makes you feel like you're being chased by a bear in the woods, which, hey, when you're running and kind of like, going for it, you ain't hungry. You're not hungry, but there's other things that happen when your fight or flight is engaged. And those sorts of things are you get dry mouth. Every patient that's on phentermine has dry mouth. And so your mouth dries up, your pupils dilate, so you might be more sensitive to light. You will feel like your heart is racing sometimes, and that can even give you some palpitations. So if you're somebody that has tachycardia or an increased heart rate, or even those palpitations, that fluttering in your chest, or a heart arrhythmia or high blood pressure that's uncontrolled at baseline, those ones I would strongly suggest that this might not be the best medication for you. If you also have some anxiety, it can kind of give you that feeling of like, I'm really like just anxious on this. It's making me feel a little bit uneasy. If you've ever had suicidal ideation, you don't want to be on this. It's going to really kind of rock your world in that aspect. And you don't want that to really worsen those types of symptoms. Now, it also can leave you feeling just really exhausted because sometimes you can fall asleep, but you can't stay asleep. So your sleep might be impacted from it. Or on the flip side of that, it might give you immense energy because again, it's like go, go, go. It's really like putting it out there. And you may feel like you can conquer the world. You can clean the house from top to bottom. You can focus more at work. Might help if you're a little ADHD. It might help with all those things, but it can impact your sleep patterns, your restful sleep, your REM sleep, and that can be a little offsetting. So I do feel like if you can tolerate the side effects of this med, and by the way, I will actually really start you off low dose here as well. I prescribe the tablet that I want you to break up into just a quarter of a tablet so that you kind of ease into it. A lot of people will say, I don't feel any different on it. And so they'll just kind of go up to either a half a tab or even the full tab right out of the gates. And that's up to you, but that's something really just to consider there as well. And then there's another medication, and it is called Contrave. Contrave's claim to fame is that it is really great at helping some of those things that are a little addictive, that it works in the reward center of the brain. So if you feel like, man, I feel like I want to eat, should I eat? And then you do eat, and then you eat too much, and then you feel guilty, and then because you feel guilty, you feel like you just want to kind of soften that emotion by eating again. You're in this vicious cycle of emotional eating. I do think Contrave is great for that. It is a combination of naltrexone, which is also the antidote to narcotics. And so it's sort of like Narcan is part of the medication. And then the other part of the medication is bupropion or Wellbutrin, which is also used for depression. So it does help you to also just feel a little bit better. So Contrave does work in some patients. Both phentermine and Contrave, when I prescribe them in their generic form, are very inexpensive, especially if you use good RX. So I can get these meds for you for sometimes less than $5 a month, if that's, especially Narcan component. When I break up those two components of the Contrave, that can be really inexpensive. So we can talk about that as well. So you have lots of options. So some people, again, phentermine, you do great on it. You tolerate the side effects. You can lose a lot of weight on it. Some people, same thing with Contrave. Sometimes the results, if you look at it across the board, though, are not as good as the GLP-1 medications. Right now, those GLP-1 medications are an injectable, and that's another thing. You might just not want to inject a medication into you once a week. Like, just don't want to do it. I get it, but I'm going to tell you, don't fear that needle. It's very, very small. It's smaller than 2 adult hairs. It's really tiny. It's like an insulin kind of subcutaneous needle, if you've ever seen one of those as well. So it's nothing to fear, but I get it. The anticipation can feel a little bit overwhelming at times as well. So let's talk. Let's talk about your options, whether you go on tirzepatide, semaglutide, phentermine, or Contrave, or you even want to say, you know what, I gave it my all. I can say that I did it, or I don't even want to do a med to begin with. Let's give ourselves grace. You have tried everything, and you are ready for something that is going to work. It's going to work in the long haul. Surgery is an amazing option for you, and we're going to help you through it every step of the way, through diets and all of our incredible programs and plans that we have. So I hope that you found this educational, informational, and very just high impact value, because Your weight is important to you. It is something that impacts every aspect of your life. And we really just feel like we are the leaders in our fields. We offer incredible care. You can check out our Google reviews on Belly by Bariatrics. We're almost to 700 five-star Google reviews at the time of recording this. And we really pride ourselves in taking excellent care of all of our patients and just really making you feel like you are part of our family. So we have lots of resources once you become part of our practice. We also offer support groups. We have lots of resource guides. We have digital resources. We have a virtual Facebook support group. We have lots of in-person meetups. And with that, we are going to be having our biggest meetup yet, which is the Body by Transformation Retreat, which is going to be held in Orlando, Florida on May 1st and 2nd at the beautiful Rosen Shingle Creek Resort and Spa. And that is going to be quite the experience. We're expecting hundreds of people from across the country who maybe are interested in surgery. Maybe they've had surgery. Maybe they're contemplating surgery. Maybe you're on a med. Maybe you're not on any of those things, but you're just looking for something that is going to help you on your personal development journey. This is all about health and wealth. It's about just visualizing your very best life, going for those 10x goals, being able to deliver on them, having an action plan, visualizing it, kind of imagining it, and ultimately manifesting it into a reality. We have some incredible key opinion leaders as speakers. We have an incredible panel. You're going to leave really changed, and that's what we want. So check that out. Go to bodybybariatrics.com/bodybytransformation to be able to register to sign up. And hurry, because if you're listening to this podcast episode in 2025, we are doing it for the price of $199. After 2025, as soon as that clock strikes midnight on 2026, it's going up. It's going up to $249.99. So you want to make sure that you get in there and you take advantage of it. And we also have a really awesome room rate of $209. So if you're coming from out of town, make a trip out of it. It's beautiful here. This is of course, world-class destination. Lots of fun things to do here in Orlando. And of course, the biggest thing is community. Community is treatment, and it's something that you want to take advantage of. So we would love to see you soon in any capacity. Thanks again for listening. Until next time, my friends, we'll hear you on the next Weight Loss Collab. See ya. Bye.